I'm introducing Dr. Hamed Ekhtiari, colleague of mine. We've been working together for the last 15 years or so. Neuroscientist, trained psychiatry, working in the US, has always been inspirational to most especially young medical students and junior doctors in the field of addiction psychiatry. Of course, you've received his small resume here, so I won't go into more details, but currently assistant professor of psychiatry at the University of Minnesota. And he's going to talk about a very interesting topic where I'm pretty sure people in the field of neuroscience or outside neuroscience would say, no, this can never happen. You cannot have anything to do with neuroscience that is clinically applicable and valuable. So without further ado, Hamed, please.
So hello, everyone. My name is Hamed. I'm really delighted to be here, and many thanks for the invitation, Alex and Gosia, and being here in University of St. Andrews. I was kind of dreaming to be here for quite a while, and I was begging Alex to invite me, and finally I'm here. So thank you very much for the invitation. First of all, you have my slides on the QR code, and I will give you QR code at the end as well if you want to have a copy of my slides. Can somebody check if the slide is working, just the QR code? Okay, you check that. Okay, so you will have the slides. So at the end, if you are interested to have the slides, you can have the slides. I don't have any conflict of interest other than the funding that I have. And many thanks to Alex and Gosia to make this happen, which is very unique opportunity. I have been traveling around the world, being involved in addiction research centers in multiple different countries. And I think this is a very unique opportunity that you brought business school and a school of medicine together and working together. So that's going to be a unique opportunity. I'm definitely looking forward to have further discussion in coming days. So just making sure, how much time do I have, Alex? Do I have till 7?
You have till 7.
Okay.
Yes. And you promised me till 7.
Okay, so talking till 7, and then we'll have
15 minutes questions.
Okay, so till 7 and then 15 minutes question. Okay, so I will make sure that I will get things done by 7. So first of all, I'm coming from University of Minnesota. It's one of the largest public universities in the US. State of Minnesota is almost something like a 20% smaller than the Great Britain. It's something like 3 times larger than Scotland in terms of the size. And it's famous. Have you heard about the state of Minnesota and what we are famous for? Cheese is mainly Wisconsin, which is a neighbor kind of a state. Okay, so we are famous for having 10,000 lakes in the state. So it's a state that is very famous for having 10,000 lakes. It's a large center, large state, and we have around something like a 6 million population. So that is the kind of the place that we are located. It gets very cold in winter times, up to something like minus 40 degrees. So it can get very cold. And I work in the university which had specific opportunities. As an example, we have a center called Center for Magnetic Resonance Imaging. And the center is the place that some of those people who have done the first fMRI things, they are in the leadership of that center. And we have the largest MRI human MRI in the center. Is a 10.4 Tesla scanner. Those who are working with MRI scanning know that 10 Tesla scanners are huge scanners. So it's a very unique center. And in the state, we have different companies, like Boston Scientific, Abbott, kind of Medtronic, those major neuromodulation medical kind of companies, they are based in the state of Minnesota. So there are lots of opportunities for innovation in medicine in the state. I work in a team of collaborators in what we call Medical Discovery Team on Addiction. We have 60 faculty members that are a part of that within the University of Minnesota, working specifically in the field of addiction. That's another opportunity that we have in the state. And my lab is mainly focused in bringing brain stimulation technologies to addiction medicine, addiction treatment. And I will give you some ideas about what are the things that we are working on. As an example, we use robots to be able to identify specific circuits in each individual patient based on the brain imaging that we do and target those circuits to be able to have access, for example, targeting specific cortical areas to access to amygdala and nucleus accumbens to be able to change the function of those areas to be able to kind of change the way that people are seeing drugs or having craving for drugs. So these are the specific technologies that we are working on. But before going to the details of the technology, I would like to start with kind of few basic things that we are going to have, basic definition that Gosia discussed and Supriya is going to continue discussion, but just some basic ideas about the key terminologies in the field. And then based on these key terminologies, we are gonna further discuss about some examples of innovation in the field. And I'm going to give you some definition, and you're going to match them with these four terms: discovery, creativity, invention, and innovation, right? So first of all, finding something that already exists in nature or reality, but was previously unknown. This is which one? Everybody agrees? That is discovery. Second one, creating a new device, process, or method that has never existed before. This is invention. And then ability to generate original and valuable ideas or concepts. Creativity. And improving or applying inventions and ideas in a way that create practical value, impact, or widespread adoption. There's going to be innovation. Okay, so these are four major terminologies. And when I'm going to discuss about some specific examples in the field of addiction, then you will tell me in terms of which one is innovation, which one is invention, which one is discovery. So we'll work on that together today. So potential fields of innovative solution in addiction medicine. As I was discussing today, of course, biotechnology and neuroscience is a very interesting area that I'm very interested to, and we try to bring those kind of innovations to the field of addiction medicine. But this is not the only area. So there are many other areas that we can have innovation. I started on the last one: workforce training innovation, integrated care model, behavioral economics, culture and social innovation, blockchain, virtual reality, augmented reality, behavioral and social innovation, digital health, pharmacological. All those areas are important, and they have very interesting potentials for innovation for addiction medicine that we can discuss. But let's just start with some examples in the field of neuroscience and having an idea what are the things that we can do there.